So, you've been told you have arthritis in your knee and you're looking to understand what it is and what treatment options you have available. In this video, I'm going to explain in simple terms what exactly osteoarthritis is and the range of treatments available to get you back on your feet, whether you choose to manage your knee pain with or without surgery. I'm Mr. Sam McElroy, specialist orthopaedic surgeon here at Chiltern Hospital, which is part of Circle Health Group, the largest independent healthcare provider in the UK, with over 50 hospital sites across the country. What is knee arthritis? This is a model of the knee, and the ends of the three bones of the knee, the femur, the tibia and the patella, are all lined with beautifully smooth articular cartilage. Any damage to that beautifully smooth surface is arthritis, and there are many causes of this. There can be an inflammatory arthritis such as rheumatoid, trauma or infection during a patient's life. There is a genetic component in some patients, but the majority present with no obvious reason for their worn out joint. The arthritis tends to be progressive with the passage of time, and the smooth surface wears out just like the shock absorber in your car, presenting with increasing pain in the knee. How do you know you have knee arthritis? Knee arthritis tends to present with pain, usually brought on by walking long distances, particularly over rough terrain. Towards the end of a round of golf, people find the game unpleasant and eventually unbearable. It tends to be progressive in that walking shorter distances will cause the same pain with the passage of time. People notice swelling, they have great difficulty extending their knee fully or bending. They find it difficult to kneel or squat. They eventually develop rest pain, which makes it uncomfortable to sit during the day. And finally, night pain, which makes sleeping unbearable and life difficult as a consequence. Early knee arthritis is usually treated non-operatively. Physiotherapy to strengthen the muscles around the knee that support the knee, and to educate patients on what activities and exercises to avoid which aggravate their underlying knee arthritis. Non-steroidal anti-inflammatory tablets such as ibuprofen, used initially intermittently, such as before a round of golf, and then as the condition progresses, used on a regular basis. Hot and cold treatment. Heat often makes the joint far more comfortable, and cold reduces the inflammatory element of knee arthritis. A good healthcare provider will be able to tailor your treatment to both you and your lifestyle. Eventually, in a number of patients, non-operative treatment will fail due to progression of their arthritis. At this point, patients have to consider investing in joint replacement surgery to restore their quality of life. Knee replacement, either partial or total, involves removing the damaged surface of the knee and replacing it with metal and plastic. This removes pain, restores range of movement and function. When you wake up from the operation, you'll be pain-free because of the anaesthetic. The following day, it's quite painful, and you'll require strong painkillers, which will usually make you relatively comfortable. The day after surgery, the physiotherapists will stand you up and walk you for a few steps. By day 2 post-surgery, you'll be walking up and down the corridor with sticks and able to do stairs, and you'll normally be discharged home at the end of day 2 or the beginning of day 3 after the operation. You have to look after the wound for the first couple of weeks, which involves rest and gentle bending exercises. By 6 weeks, most patients will be walking comfortably over a mile, and this will increase steadily with time. There's a dramatic improvement in knee replacement function in the first 6 months post-surgery, and then a further improvement in the second 6 months, but not as dramatic. By a year, most patients' walking distance is unlimited. They can play non-competitive sports, a round of golf, social tennis. They don't normally let you play very competitive sports or run. They will let you ski, but you have to be a little more careful. Most knee replacements performed over the age of 60 will last a lifetime. Lots of patients ask, can they kneel? And they can kneel perfectly. It just feels a little different because of the scar on the front of the knee and a slight numb patch on the outer side. So that was a rundown of what arthritis is and how it can affect you. We also looked at what treatments to consider. Ultimately, it's your choice. We're here to help you decide what's best for you. If you're still unsure, it can be helpful to discuss all of this in more detail with a specialist consultant. To come and see me for a consultation, you can book online via the link in the description below this video, or to search for your nearest local Circle Health Group hospital and the next available consultant in your area, go to circlehealthgroup.co.uk. If you have any questions on anything I've covered, please comment below this video, as we'd love to hear from you. Otherwise, thanks for watching.